the silent killer, hypertension. There are many misconceptions surrounding high blood pressure, also known as hypertension. Firstly, contrary to popular belief, high blood pressure doesn't always show symptoms. You may feel well but still have high blood pressure. Secondly, high blood pressure isn't exclusive to older individuals. Due to genetic factors, even younger people may experience it. Thirdly, high blood pressure isn't solely harmful to your heart. While it does strain your heart by increasing the pressure needed to pump blood throughout your body, it also damages other blood vessels. This can lead to a range of issues affecting various parts of your body. High blood pressure is often accompanied by artery blockages and atherosclerosis, reducing blood flow to the brain and increasing the risk of strokes and cognitive impairments. Delicate eye vessels are also affected, potentially causing vision problems like retinopathy and optic nerve damage. Similarly, kidneys can suffer damage due to high blood pressure, sometimes resulting in kidney failure. Fourthly, relying solely on medication isn't sufficient to control high blood pressure. If you're dealing with hypertension, you need a strong will and commitment to a healthy lifestyle in the long term. Simply reducing salt intake won't be enough. Determining which medication to take for managing high blood pressure is your doctor's responsibility, but sufficient physical activity and adherence to a healthy diet are yours. Before we begin, we'd appreciate it if you subscribe to our channel, and if you found this video helpful, please give it a thumbs up so we can create more content on managing high blood pressure. Let's explore together what actions we can take to control our blood pressure. First and foremost, you need to change your diet, which is what we'll discuss in this video. We'll talk about which foods to avoid and what to eat instead to help lower your blood pressure. 1. Avoid salty foods. A person with high blood pressure should limit their sodium intake to no more than 1,500 milligrams per day. If you have high blood pressure, it's crucial for you to avoid certain types of salty foods as they can worsen your condition. You should steer clear of foods rich in sodium, as excessive intake can lead to water retention, increasing your blood volume and consequently raising your blood pressure. Examples of foods to avoid include salty cheeses like feta and parmesan, processed snacks such as chips and pretzels, pickled vegetables, and salty condiments like soy sauce and barbecue sauce. Also, be cautious with processed meats like sausages and bacon, as well as canned seafood products such as tuna, which can also be high in sodium. By limiting your consumption of these salty foods and paying attention to hidden sources of sodium in processed foods, you can take significant steps toward managing your blood pressure and reducing the risk of associated complications. 2. Lower your blood cholesterol. When your cholesterol is high, it's like having too much of that bad LDL cholesterol floating around in your blood. Now, this stuff can stick to the walls of your blood vessels, making them all thick and stiff. And guess what? When your blood vessels are less flexible, they have a harder time expanding and contracting like they should. That's where the trouble starts, because this rigidity increases the pressure in your blood vessels, making your blood pressure go up. So, to keep things in check, you've got to watch what you eat. Avoid fatty meats like beef and lamb, full-fat dairy products, and processed snacks. Skip the cholesterol-rich foods like egg yolks and organ meats too. Oh, and those sugary treats. Best to limit those too because they can hike up your cholesterol levels. Instead, opt for healthier fats like olive oil and load up on fruits, veggies, and whole grains. By cutting back on these foods and making smarter choices, you can help keep your cholesterol levels in check and lower the risk of heart disease and other nasty stuff. Easy peasy, right? 3. Caffeine. Caffeine can temporarily raise your blood pressure, especially if you're sensitive to it. It stimulates your nervous system, causing your heart to beat faster and your blood vessels to narrow. This can lead to a spike in blood pressure. So, it's best to go easy on the coffee, tea, and energy drinks if you're trying to keep your blood pressure in check. 4. Alcohol. Drinking too much alcohol can raise your blood pressure. Alcohol contains calories and can contribute to weight gain if consumed excessively. Additionally, it can interfere with the effectiveness of blood pressure medications. So, it's important to limit your alcohol intake or avoid it altogether if you're trying to manage your blood pressure effectively. 5. Cigarettes. Smoking damages your blood vessels, making them narrower and less flexible. This makes it harder for your blood to flow smoothly, which can increase your blood pressure. Plus, smoking also damages your heart and puts you at a higher risk of heart disease and stroke. Avoiding these substances can help you manage your high blood pressure and keep your heart healthy. Now, let's see what you can add to your diet to help control your blood pressure. Also, since high blood pressure is often accompanied by high cholesterol, we've made another video suggesting foods that help lower cholesterol, and you can watch that too. Number 1. Potassium. Potassium helps lower blood pressure by balancing out the negative effects of sodium and relaxing blood vessel walls, which reduces pressure and allows blood to flow more easily. It also helps the body excrete more sodium through urine, further aiding in blood pressure control. To get enough potassium, include a variety of foods in your diet. Fruits like bananas, avocados, carrot and sweet potatoes, and vegetables like spinach, cabbage leaves, and beans are excellent sources. The recommended daily intake of potassium for an adult is about 2,500 to 3,000 milligrams. For example, eating 2 bananas and 1 cup of cooked spinach provides approximately 1,500 milligrams of potassium. To meet your daily needs, you would need additional potassium-rich foods. However, consuming too much potassium can lead to hyperkalemia, causing irregular heartbeats and muscle weakness, so it's important to balance your intake. Number 2. Magnesium. Magnesium helps relax blood vessels by blocking calcium and boosting nitric oxide production. It also balances potassium and sodium levels, reducing inflammation and supporting overall health. Aim for 420 milligrams of magnesium daily, found in almonds, sesame seeds, flax seeds, chia seeds, pumpkin seeds, and sunflower seeds. Consider magnesium supplements after consulting a doctor, but be cautious of side effects like high blood pressure and kidney stones due to their strong absorption. Number 3. Calcium. If you're not getting enough calcium from your diet, like if you don't eat much dairy or follow a vegan diet, it's important to know that low calcium levels can lead to higher blood pressure. This happens because a lack of calcium messes with hormones like PTH and aldosterone, which can cause your body to hold onto sodium and raise your blood pressure. So, if you think you're not getting enough calcium, try eating more calcium-rich foods like dairy products, sesame seeds, chia seeds, and almonds. This can help keep your blood pressure in check over time. Number 4. Antioxidants. Antioxidants are great for our blood vessels' health. They reduce body inflammation, including inflammation in blood vessels, which ultimately prevents LDL plaque buildup in our heart vessels. Also, antioxidants help increase nitric oxide secretion, which widens blood vessels and lowers blood pressure. Berries like blueberries, cranberries, raspberries, and strawberries, along with citrus fruits such as oranges, lemons, and grapefruits, contain vitamin C, a powerful antioxidant for our body. Additionally, vitamin E-rich foods like avocados, kiwis, and olives also help lower blood pressure and improve our overall health. Number 5. Fibers. Fibers play a crucial role in our body by reducing the absorption of sugars and fats from the food we eat, which helps us manage our blood sugar and cholesterol levels. Soluble fibers, like forming a gel-like substance, decrease the absorption of sugars, fats, and even sodium, ultimately improving insulin sensitivity, reducing inflammation, and enhancing vascular health. Moreover, for controlling blood pressure, It's essential to lower your weight, and fibers contribute to this by increasing the bulk of food in the digestive system, leading to a feeling of fullness and assisting in eating less. Aim to consume at least 25 to 30 grams of fiber daily. Wheat bran, chia seeds, and flax seeds are significant sources of fiber, and consuming 100 grams of any of them daily can meet your daily fiber needs. Additionally, legumes like beans, chickpeas, and lentils, as well as fruits like apples, oranges, and strawberries, contain smaller amounts of fiber. Including these foods in your diet can help improve your health and assist in weight and blood pressure management. If you found this information helpful, please give this video a thumbs up and subscribe to my channel for more health tips. Thanks again for watching, and take care of your health. See you in the next video. Bye.